Greetings, this is Brandon E., your Pharm.D, and welcome to my YouTube page. Today we're going to talk about a very important topic. You may have this condition, you may know somebody that has it, or you may know somebody and they develop it in the future, and that is cancer. I'm a pharmacist. I work in a community setting, and I help treat patients with a variety of different diseases, but I focus on cancer patients, so I'm an oncology pharmacist. Some of the patients I work with, they're being treated for cancer, they're getting lab work done, they're going to doctor's appointments, but they truly don't know what cancer is. So that's what prompted me to create this video. So what is cancer? Cancer is a group of over 100 different diseases. It's estimated that about 2 million people will be newly diagnosed with cancer this year, and that about 600,000 people will die from cancer this year. So what is cancer? Cancer at the core is an overgrowth of abnormal cells. If this overgrowth occurs in the blood, you have what's called a blood cancer. If it occurs in an organ or a tissue, you have what's called a solid tumor cancer. Solid tumor cancers are the more common type of cancer, and these occur in areas like the bone, the muscle, the liver, the lung, the breast, the prostate, and other areas. When you think about an overgrowth of cells, you may think this is actually a good thing. If I have an overgrowth of skin cells, my skin's going to look clearer. If I have an overgrowth of lung cells, I'm going to be able to breathe easier. If I have an overgrowth of liver cells, my liver's going to be healthier. But again, in cancer, it's an overgrowth of abnormal cells. And the key word is abnormal. These abnormal cells group or clump together into what are called tumors. And these malignant or cancerous tumors, as opposed to benign or non-cancerous tumors, take up space and use nutrients that healthy cells would normally use. Let's look at an example. Let's take lung cancer for an example. Let's say we have a patient and he is a chronic smoker. He smoked for many years, and let's say one day he develops a cough. He takes over-the-counter medicines, he tries home remedies, he just can't shake this cough, so he goes into his doctor's office. His doctor diagnosed him with lung cancer. What does this mean? This means he has an overgrowth of abnormal cells in his lungs. This overgrowth is disrupting the function of his lungs, causing him to cough. Now, let's say, for example, the cancer in his lungs decides to spread. Let's say it spreads to his liver. This is what we would call metastatic disease or metastatic cancer, where cancer spreads from one area of the body to another area of the body. So now this patient would have an overgrowth of abnormal cells in his liver, which would disrupt the function of the liver. And as we know, the liver does a variety of things in the body. It helps our body to produce cholesterol, it breaks down medicines, and helps remove toxins from the body. So this metastatic or stage 4 disease can be fatal. Now let's switch gears and talk about blood cancers. Before we talk about blood cancer, you have to understand a little bit about what the blood is composed of. The blood is composed of 4 components: plasma, the liquid portion of the blood; red blood cells, which carry oxygen throughout the body; white blood cells, which help our body fight infections; and platelets, which cause blood clotting. These 3 types of cells, red blood cells, white blood cells, and platelets, form in the bone marrow when immature stem cells mature. An overgrowth of one of these cells can lead to cancer. The more common type of blood cancers include leukemias, lymphomas, and multiple myeloma. Let's discuss multiple myeloma. Multiple myeloma is an overgrowth of abnormal plasma cells in the bone marrow. This overgrowth of cells can crowd out other healthy cells in the bone marrow. So as a result, you can have less red blood cells, putting you at risk of anemia. You can have less healthy white blood cells, putting you at increased risk of infection. And this is occurring in the bones, so you can have bone disease, along with a host of other problems. This was just a sample of what cancer is. We talked about solid tumor cancers. We talked about blood cancers. Let me know in the comments if you like this video, if you want me to do an extension of this video, or what other topics you want me to discuss. Also, be sure to like, share, and subscribe. And hope again you like this video. This is Brandon E., your Pharm.D. Remember to drink water, and hope this helps.